I'm Dr. Mushi, Program Manager for a Cancer Collaboration in Dar es Salaam, Tanzania. My talk is on representation of Tanzanian women in a high learning institution, the case of Muhimbili University of Health and Allied Sciences. Why MUHAS? MUHAS is a long-standing, reputable, and well-established high learning institution with maturity in both aspiration and leadership. That's a great place to analyze the representation of women in decision-making positions. Women leaders in health and high learning institutions are disproportionately low and underrepresented. 70% represent women in the global health workforce, but only 25% hold the senior leadership roles. Last year, on average, only 34% females were registered at MUHAS. With effective women, decisions are more likely to be inclusive, representative, and take diverse views into account. Women provide clarity of motive, purpose, and guidance. The goal of the project is to improve gender diversity in leadership representation in a high learning health institution in Tanzania. The project has two phases. Pre-funding phase, where retrospective data abstraction was conducted on a 10-year trend of women leaders in 5 decision-making categories. Phase 2, needs assessment and gap analysis, will look into barriers and facilitators from key stakeholders, followed by the development of leadership training curriculum. The framework includes involving stakeholders in the needs assessment and gap analysis, developing a curriculum, conduct intervention, followed by evaluation and documentation of positive changes observed. Key findings: in the 10-year trend, there has never been a woman in the top executive position. Less women representation in the directory positions as well. Highest at 30% in 2015-2017. Promising representation is seen in the dean's category. Highest at 67% in 2017-2019, but a sharp drop in 2023 down to 17%. Head of departments, 30% in 2015-2019, a rise in 2020-2023 at 45%. On average, 34% of women representation across the board. With head of departments, lowest women representation observed in the School of Public Health at 14%, but highest at 57% in 2021-2023. Strongest women representation seen in the School of Pharmacy, highest in 2024 at 80%. Most of the workforce in nursing is women, but on average, women representation is 34%. We need to change the narrative, supporting women leaders by providing the necessary skills, make efforts to bridge existing gender disparities, involving women in decision-making positions so we can shape the directions, guidelines, and policies. We need dedication from all women to work together, elevate one another, and proactively develop a curriculum informed by the current successful women leaders. Imagine a world with a diverse, inclusive, and interdisciplinary leadership. The need for women leaders to influence gender-sensitive curriculum, where strong women leaders to serve as role models to young and upcoming future leaders is crucial. Going forward, us as women need to realize that we have the responsibility, first by showing interest and with confidence strive to take leadership roles. There are women who qualify but hesitate to take on leadership roles. A lot of effort is still needed to increase women representation in decision-making positions because women leaders are agents of change in ways that benefit both men and women. This leadership journey has provided a safe space and platform for impactful personal growth, raised my confidence, dispersed the imposter syndrome, identified my strength. I am resilient, a leader, a motivator, mentor, communicator, and I do inspire others. I lead with a purpose, with a vision. I set goals and strategies to achieve those. I now recognize my blind spots and areas that need improvement, including delegating more. I've cultivated skills to mitigate and navigate challenges and conflicts. I have received great support from coaches and my mentors. And I have cultivated a new network group, a diverse group of sisterhood, a whole new family. And with that, I do thank everybody for listening.